Welcome to the Material Classification module. Here we give an overview of the different material groups, train the theoretical background, and build a bridge to the indication areas of the individual material groups. Materials, slide 5. Here we give an overview of the four main material groups and their main characteristics, which are crucial for practical processing and indication. There are so many different materials that it is hard to keep track of them all. We would like to show you a classification and division that puts the practical aspect in the foreground. In summary, we need to know which main groups there are of which materials and what distinguishes these groups in terms of practical relevance. And what effect do these dental treatments have for adhesive cementation? And where is the main field of application for the respective material group? For which indication is which block best suited? These are the questions that are highly relevant for the practitioner and which we would like to shed some light on in this module. With this overview, we would like to present the variety of materials clearly and shed some light on the diversity of the materials. Basically, the CAD/CAM blocks can be divided into four major material groups, which we have marked in different colors here in this overview. Please take note for further presentations. These color markings of the different main groups will run through all presentations. This gives us a good reference at all times, and we can always easily recognize and assign these material groups. Let's start with the big picture and break the groups down into different sections. We have four main groups. The group of silicate ceramics or glass ceramics, the group of zircons, the group of hybrid ceramics, and the group of acrylates. These groups are subdivided into subgroups. In the case of silicate ceramics, these are feldspar ceramics or glass ceramics. The zircons are divided into glass infiltrated or polycrystalline zircons. For hybrid ceramics, the subdivision is mainly about whether it is more of a composite-based material or a glass infiltrated material or a polymer infiltrated ceramic. The acrylates are subdivided according to their main material. There are two subgroups, composites and PMMA. What is practically relevant for us now? In the end, only the subgroup is practically relevant for us, because the main ingredients of the material are decisive for processing and for adhesive bonding. Since the bonding protocols module deals precisely with the attachment of the individual components and the chemical bond to the individual components, this completes the circle. Now we can understand why it is necessary to know the main components of the blocks. Let's take a look at some old acquaintances in the overview. There, in the group of silicate ceramics, we find Empress and Emax, and also initial Lissi and Tessera can be found there. Celtra Duo, Suprinity, Ceric Blocks, Vitamark II, Trilux Forte, all terms that the long-term practitioner has certainly heard before. As Ceric users, and mainly chairside practitioners, we tend to focus on the polycrystalline group of zircons. Within this group, we find the latest generation of highly translucent zircons on the right-hand side, which are of the greatest interest to us chairside practitioners. The hybrid ceramics are divided according to their main components. This graphic subdivision shows us quite clearly that with Vita Enamic on the left side, there is basically only one true hybrid ceramic that is infiltrated by composite, while on the right side, we find the composite-based materials. In other words, the main component in these materials is not glass or glass ceramic, but composite. To put it bluntly, these are not true hybrid ceramics. We divide the fourth group of acrylates into composites and PMMAs. Here we find well-known names such as VitaCAD Temp or TeleoCAD. Finally, we need to talk about a few general properties of the materials in order to classify them practically. On the one hand, we have the flexural strength and the practical advantages of that, and on the other hand, of course, we have the aesthetics, which is also crucial for us. First, let's look at the flexural strength and its practical impact. There are two different ISO certified tests with which the flexural strength can be determined. On the one hand, there is the 3-point flexural strength test. A material sample is placed on two supports at a certain distance from each other. A certain force is applied to the material sample in the middle between the two supports. The force that is measured there is the one at which the material just holds up and does not break. On the other hand, we have the biaxial flexural strength test. Here, the material sample rests as a disc on three supports, and the force also acts on the material from above. In this test, more force is needed to make the test specimen break. This means that in the biaxial test we have a higher value at the end, and therefore the material appears harder in this test. For this reason, it is very important to know which test method was used to determine the specified bending strength. Only flexural strengths that have been determined with the same test method can be compared with each other. Here is a hint for the practitioner. It is often the case that it is not stated or not clearly evident which test was used to determine the stated bending strength. Materials, slide 12. In this diagram, we show the effects that the determination of the different values with the different test methods has on the eye of the beholder. If we take a look at the biaxial test for kata zirconia, we see that the value for biaxial is far above the 1000 megapascals in the 3-point test, but only at 763. Similarly, if we take a look at the Emax material, there we are at about 360 megapascals in the 3-point test. In contrast, the biaxial test is 530. And for practical use, 530 MPa is often given as the value that describes the hardness of this material. Of course, if we now want to compare this with, for example, katana zirconia, we can only do so if we use the same test as the basis for our comparison. Then we have to talk about the 360 megapascal flexural strength for Emax, compared to the published 763 megapascals, which are much lower here than in the biaxial test. With all these values, which of course we as practitioners do not always have at our fingertips, the question also arises as to how much flexural strength I need to adequately restore a tooth in the long term. In comparison with the natural tooth structure, tooth enamel has a flexural strength of approximately 80 to 120 megapascals in a 3-point test. If we now consider that 95% of all feldspar restorations are still clinically intact after 5 years, and after 10 years approximately 90% are still functionally intact, then we look at the flexural strength of feldspar restorations. That is around 150 megapascals. The conclusion from these figures shows us that feldspar ceramics work very well if the recommended material thickness of the restoration has been adhered to. We know that the reduction for field split ceramics, according to their hardness, should actually be at least 1.5 millimeter occlusally, rather 2 millimeter, in order to guarantee precisely this long-term clinical function. Conversely, this means that the harder a material is, the more conservative we can prepare it, the more tooth structure we can save, because we need smaller material thicknesses in order to achieve similarly good clinical success rates. We as practitioners can always be confident that the minimum layer thicknesses specified by the manufacturer will result in a good survival rate of the ceramic. Let's look at the aesthetic aspect, looking at the different blocks. When we talk about aesthetic restoration, as practitioners, we all know that it is not just about the right color. The outline shape and the silhouette plays a very big role. The surface texture and the surface morphology is a very crucial point for an aesthetically appearing restoration. The color value, whether we go more towards the grey or the luminous, is decisive for the color effect. The translucency is a very big factor. Do I have a more translucent set of teeth or very opaque teeth? The chroma will be decisive for the later aesthetic effect. How high is the color content? How high is the chroma? The classification of the 4 classical shade groups is of course also decisive for the aesthetic effect. Of course, it depends on whether I have prepared my outline form in such a way that I will have the same layered pieces later on in my ceramics, and that my preparation form represents the lowered and simplified silhouette of my later restoration. The surface and the texture of the surface play a decisive role for a result that is as aesthetic and as naturally looking as possible. The intensity of the color, that is, how much chroma does my tooth need? Which of the 4 classical groups are we in, and what does my color value look like? Do I have a more luminous tooth or a more grayish tooth? Where are my basic color values here? These are things that have to be considered when choosing colors and when choosing blocks. We think most practitioners do their color selection according to the classic Vita color ring. There are the 4 groups with the different basic colors such as orange, yellow, grey and brown, or also in red in the D color group. And since most practitioners use this classical color ring in 2D, here is a practical translation to the 3D master color ring from Vita. These colors from the 3D master are often found on some feldspar or silicate ceramic blocks. Ultimately, it plays a big role how translucent the natural neighboring teeth or the entire dentition appears. If we have highly translucent restorations, we have older crowns or bridges in the neighboring area, which usually appear relatively highly opaque. What is the age of the patient? How much have the enamel areas already been worn away? Corresponding information on translucency can be found in the manufacturer's specifications in the abbreviations HT, LT, and MT. These designate the degree of translucency of the block in question. High translucency is indicated by HT, low translucency or higher opacity by LT, and medium translucency by MT, which represents a good average between HT and LT. When do we use what? Highly translucent blocks are the blocks of choice for highly aesthetic restorations on non-colored tooth stumps with a thin wall thickness. They are then used to optimally replicate enamel. As the name suggests, The restoration will later be very translucent. That is, the substrate will have a strong effect on the color effect. In this case, the best way to control the color effect is via the cements. We have try-in pastes that we can use to test in advance what the color effect will be later on. It is of the utmost importance that the cement we use for adhesive luting must be color stable in any case, so that we can maintain this aesthetic result in the long term. And we specify this again in the bonding protocol. For example, the purely light curing cements that are particularly color stable. For example, they are used here when very thin veneers or tabletops with high translucent materials are to be processed. As the name suggests, the LT blocks with low translucency result in a more opaque looking restoration, which often appears lighter but is more likely to cover a dark tooth stump, and where the tooth stump color does not directly affect the aesthetic shade effect of the restoration used. And so, these blocks tend to be the blocks of choice next to metal ceramic crowns, or when we have tooth stumps that are discolored or where there is a metal buildup in the teeth. Due to the opacity, the transition between crown and tooth is often very visible, and there is often a relatively clear difference in color. So sub-gingival margin preparation is definitely recommended with this material. Otherwise, this material is very well suited for crowns in the posterior region, but also just as well in the anterior region with the appropriate gingival localization of the crown margin. And at least a MT medium translucent block somehow represents a middle ground. Let's take a look at our material overview and now focus on the individual groups with their corresponding color coding. Materials, slide 25. And now we divide the groups according to different properties. Here we have the flexural strength. What does that look like in the different groups? If we look at the different materials in the large group of silicate ceramics, which are all intended for definitive restorations, we notice that we have a very high range from 150 megapascals up to 550 megapascals. For zircon, this range is much higher, starting at 763 megapascals and ending at 1200 megapascals. The flexural strengths of the hybrid ceramics are significantly lower, with a range from 140 to 250 megapascals. The acrylates are a bit out of the way, since these are materials that are not approved and intended for a definitive restoration. The average flexural strength of acrylates is about 80 megapascals. We will now take a closer look at the individual material groups and break them down to show which material examples, which blocks have approximately which flexural strengths. In the group of silicate ceramics, the feldspar ceramics form a unit. Examples of materials are Trilux Forte and Mark II from Vita and Ceric blocks from Dentsply Sirona. All three of these materials are feldspar ceramics and all exhibit a flexural strength of 154 megapascals in the 3-point test. GC initial L or F from GC is a lucite reinforced feldspar ceramic and has a flexural strength of 200 megapascals in the 3-point test. The Celtra Duo material from Dentsply Sirona is a zirconium reinforced glass ceramic and has a flexural strength of 210 megapascals in the polished state in the 3-point test. After glaze firing, this value increases to 370 megapascals in the 3-point bending test. Emax CAD from Ivoclar Vivident has a flexural strength of 360 megapascals in the 3-point test. Initial Lisi from GC is a ready crystallized lithium disilicate ceramic for which no results are available in the 3-point flexural test and therefore not directly comparable with the flexural strengths of the materials mentioned so far. In this case, we use the bending strength in the biaxial flexural test of Emax CAD, which is 530 megapascals, and now we compare it with the value of the biaxial flexural strength test of initial Lisi blocks, which is 408 megapascals and therefore slightly lower. Vita Suprinity from Vita is a partially pre-crystallized zirconia infiltrated glass ceramic and is roughly on par with Emax CAD at 420 megapascals in the 3-point bending test and 540 megapascals in the biaxial bending test. The ceric tessera material from Dentsply Sirona has made a significant leap forward. Tessera is a lithium disilicate ceramic reinforced with aluminium silicate and zirconium. This material exhibits a flexural strength of 550 megapascals in the 3-point test and over 700 megapascals in the biaxial test. This makes this material the hardest in the group of silicate ceramics. In the group of zircons, we consider only the polycrystalline zircons. These are, on the one hand, the conventional colored opaque zircons, and on the other hand, the newer translucent speed-sintered zircons. The opaque zircons in Chorus TZIC and Ceric zirconia from Dentsply Sirona and the Emax Zircad Multi from Ivoclar have approximately the same flexural strength in the 3-point test of over 900 megapascals. The two highly translucent speed-sintered zircons, Katana zirconia from Kurare Noritaka and Ceric MTL zirconia from Dentsply Sirona, are in a lower bending strength range. For example, the Ceric MTL zirconia material has a flexural strength of 850 megapascals in the 3-point bending test. Katana zirconia has a value of 763 megapascals in the 3-point bending test. However, it has been shown that higher strengths are achieved in speed sintering, and here a value of 859 megapascals is given, so that these materials are roughly on a par in terms of flexural strength. Let us look at the flexural strengths in the group of hybrid ceramics. Vita Anemic, a glass ceramic infiltrated with composite, has a flexural strength of 160 megapascals in the 3-point bending test. Shofu's Block HC has a flexural strength of 191 megapascals in the 3-point bending test. Lava Ultimate by the 3M company is a hybrid ceramic with a flexural strength of 200 megapascals in the 3-point bending test. Katana Avencia LT from Kurare Noritaka has a flexural strength of 233 megapascals. GC's Cerasmart material has a flexural strength of 230 megapascals, and the more advanced Cerasmart 270 material shows a flexural strength of 245 megapascals. The acrylates such as CAD Temp from Vita and Telio CAD from Ivoclar Vivident have a flexural strength of over 80 megapascals in the 3-point flexural test. The flexural strength is only one important factor for the indication. So let's look at the groups in terms of their indication. Silicate ceramics are the classic materials for single tooth restorations. Silicate ceramics still deliver the highest aesthetic results, especially in the field of highly aesthetic tooth restorations. Bridges can also be fabricated with silicate ceramics. The material Emax CAD from Ivoclar Vivident can be used to fabricate bridges in the anterior region. This indication is extended to the second premolar. This material is not approved for the posterior region. Implant restorations can also be fabricated with silicate ceramics, for example with Emax CAD or now also with Ceric Tessera. These materials are available in the form of mesoblocks with an interface to the titanium base. Due to its high hardness, the range of indications for zirconia extends from single-tooth restorations to 3-unit bridges and implant restorations. Due to the high strength of zirconia, it is the material of choice where space is limited and there is only a slight reduction in tooth substance. With the highly translucent aesthetic zirconia, zircons are now also available for attractive aesthetic monolithic restorations with anterior and posterior crowns. The classic indication here is more in the crown and partial crown area, but of course other single tooth restorations can also be fabricated with the zirconia. Due to the high flexural strength, bridges up to 3 units are possible without limiting the range of indications. With the highly aesthetic zircons, monolithic chairside restorations are now also part of the indication range. Hybrid ceramics are only available for single-tooth restorations in small blocks, and implant restorations are also possible. For example, the Vita anemic material offers blocks with an interface for bonding to the tie base. The acrylics indicated for long-term temporary restorations are available in large bridge blocks from which both bridges and single-tooth restorations can be milled. Temporary restoration of implants is also possible with ThelioCAD material. There, mesoblocks with an interface to the tie base are available. In summary, for the practitioner, silicate ceramics still offer the most easily achievable highest aesthetics. They are materials that are very fast in their fabrication, but also have sufficient hardness to produce restorations that are durable in the long term. With zircons, hardness is right at the top of the list. However, with the newly highly aesthetic speed sinter zircons, aesthetics have become much better, and speed is now also no longer a criteria for not using these materials chairside. In the group of hybrid ceramics, it has to be said that speed is right at the top and aesthetics are somewhat subordinate. We attribute this to the fact that hybrid ceramics are less easy to characterize and individualize because no glaze firing is possible. As far as the hardness of these materials is concerned, this group is the one with the lowest flexural strengths and is therefore definitely only suitable for single tooth restorations. Let's take a look at the material composition in the different 4 groups. The silicate ceramics always have a glass phase. The zircons consist mainly of zircon dioxide and the hybrid ceramics mainly of composites. The one exception is Vita anemic. Here we actually have a higher proportion of a silicate ceramic, and therefore Vita anemic is also a true hybrid ceramic. The group of acrylics only contains composite or PMMA materials. Slide 30. The main components of the four different material groups determine the further dental processing. The surface of all materials can be cleaned with phosphoric acid, but this is not necessary for acrylics because they are not adhesively bonded. What is very important here is that the cleaning of zircons must never be done with phosphoric acid. The phosphoric acid would occupy the reactive groups of the zirconia so that the subsequent adhesive cementation is disturbed. In general, saliva or blood, that is, protein-containing contamination, can never be removed with phosphoric acid. Always, other surface treatment is necessary for this. The glass phase in silicate ceramics indicates that hydrofluoric acid or katana cleaner is suitable for removing protein particles from the surface. In zirconia, the surface can be sandblasted or katana cleaner can be applied. Hybrid ceramics can also be sandblasted or katana cleaner can be used to clean the restoration. Similarly, the acrylics can also be sandblasted or cleaned with katana cleaner. According to the bonding protocol, the surface of the materials must be enlarged and conditioned. For this purpose, the application of hydrofluoric acid for silicate ceramics due to the glass they contain. And for the other materials, the surface enlargement can be done by sandblasting. The subsequent chemical bond is also determined by the main components. Therefore, the chemical bond to the glass phase is established by silana, for zircons by MdP, for hybrid ceramics by silana, and for the acrylates there is no adhesive bonding. So that was the overview. Now we will go a little deeper into the individual groups. As already mentioned, silicate ceramics always contain a glass phase. And silicate ceramics are nevertheless a very indifferent group of materials. For example, we have the lowest strength in the feldspar ceramics, and through different combinations of additives, we can reach 700 megapascals in the biaxial bending test with ceric tessera. Clinically, this group is the best compromise between aesthetics and hardness. This group offers the materials with the best aesthetics, but also with the lowest strength in the case of feldspar ceramics. Materials. Slide 35. Glass ceramics must be bonded adhesively. They can always be etched with hydrofluoric acid to enlarge the surface. They must not be sandblasted under any circumstances because of the risk of microfractures. Silana is the chemical bonding agent for adhesive luting. And in general, it can be said that glaze firing and therefore characterization and individualization of this restoration is always possible. Pre-cleaning with phosphoric acid is possible, but can never replace hydrofluoric acid etching for surface enlargement. With the feldspar ceramics, we have the highest aesthetics for single tooth restorations. Here we have the Ceric Blocks PC, the Vita Blocks Mark II, and Trilux Forte, and the Real Life. GC, Initial LRF, and EM Press offer high aesthetics and little higher strength. Ceric Tessera, Celtra Duo, Vitae Suprinity, and Emax offer higher strength in this group and also high aesthetics. With zircons, we distinguish between different generations of zirconium oxides. The decisive factor here is the yttrium oxide content. Yttrium oxide strengthens the zirconium and is the decisive factor for the stability, but also for the translucency. Therefore, a low yttrium oxide content leads to a lower translucency but a higher flexural strength of the material. The zircons from the 3 yttrium generation, such as Incor's TZ or Ceric zirconia, shine with a high bending strength of approximately 1200 MPa in the biaxial and over 900 MPa in the 3-point bending test. However, they are not very translucent and therefore only suitable for aesthetic monolithic restorations to a limited extent. Katana zirconia STML, but also Ceric MTL zirconia, are less resistant to bending due to their higher yttrium content and show values around 850 MPa in the 3-point bending test. The crystalline structure of these zircons is more cubic, and therefore these materials are very highly translucent and therefore particularly aesthetic. These materials are pre-sintered and so can be finished in 18 minutes. As will be shown in this slide, zircons differ in their crystalline structure. For example, the tetraconal zircon is particularly hard but also particularly less translucent. It is converted into a cubic zircon with a larger particle size and more cubic crystalline structure by adding yttrium and a precise temperature. This makes the material less stable but more translucent and therefore more aesthetic. This diagram shows us that with increasing yttrium oxide addition, the material becomes more cubic and therefore the translucency of the material and the crystal size increases. At the same time, the bending strength decreases with increasing yttrium content. This overview of the different zircon generations should make it a little easier. Here it is shown in the different generations how the yttrium content changes, namely increases, so that the hardness decreases but the translucency increases. This results in the different indications of the different groups. The harder the material, the more suitable for framework materials. For this indication, the aesthetics are not important. The hardness is decisive. With increasing yttrium content, as already mentioned, the hardness decreases. The crystalline structure changes towards cubic. This makes these materials more suitable for monolithic restorations. Progressive multi-generation materials are now used in the laboratory. In these materials, the different layers with different properties are combined with each other and are suitable for large span work for this reason. To summarize, it can be said that the flexural strength of all zircon generations is absolutely sufficient for single tooth restoration and also bridge reconstruction up to 3 units, and therefore for the chairside restoration. The harder the material, the more opaque it is also, and the less suitable it is for monolithic restoration. This also results in the indication for framework materials that need to be veneered. The latest generation of 4 and over 4 yttrium zircons can therefore be used chairside for highly aesthetic monolithic restorations. It offers high flexural strength, high translucency, and it can be sintered quickly as it is pre-sintered. Examples of this class of materials are Katana zirconia STML and Ceric MTL zirconia materials, slide 43. Let's move on to the group of hybrid ceramics and take a closer look. The name hybrid ceramic hides the fact that it is a mixture of different materials. Here we have the real hybrid ceramic Vita anemic with a proportion of 86% ceramic in a composite matrix. This means that the ceramic portion is predominant. The other materials consist primarily of a composite resin matrix with various fillers. These are cured synthetic resins with metacrylate monomers and fixed fillers with colloidal silicone and aluminium oxide. Examples of this material are Katana, Avencia, Lava Ultimate, and Serra Smart. As a result, the main component of the material determines the pre-treatment for adhesive cementation. If we have more ceramic in a composite matrix, this material is to be treated like a silicate ceramic. It can be etched with hydrofluoric acid, but the surface can also be enlarged by sandblasting. Sirona is required for chemical bonding. Cleaning with hydrofluoric acid has no negative effect on adhesive. If the main constituent is composite or metacrylate monomer with fillers, then this material should be treated like a composite. The surface is enlarged by sandblasting, and Sirona promotes chemical bonding for adhesive cementation. Cleaning with phosphoric acid is also possible. All hybrid ceramics have one thing in common. They must never be fired. If the material is to be characterized in the sense of individualized by painting, we only have the option here of painting with composite stains. For this, the surface must be treated with a suitable bonding agent. The composite stains can be applied and are light cured. The indication for acrylics is in long-term temporaries. On the one hand, we are talking about the PMMA, polymetal methacrylates. One product example is TelioCAD from the company Ivoclar Vivident. On the other hand, we are talking about acrylate polymers with microparticle fillers. Here, VitaCAD Temp should be mentioned as an example. Acrylics, just like hybrid ceramics, must never be glazed in the kiln because of their structure. They can only be polished and they are sandblasted for surface enlargement. These materials are not cemented adhesively. They are cemented temporarily, and any temporary cement can be used for this purpose. However, it should be noted that this cement should be eugenol-free in order not to negatively influence the subsequent adhesive bond.